So my speech is going to be about epidurals. The general purpose of my speech is to inform, and the specific purpose of my speech is to talk about all there is to know about an epidural. Childbirth can be a very beautiful and a painless situation, all thanks to a medication called epidural. This epidural is very famous that a lot of the times women just go into the hospital and ask for it without knowing what it is or not knowing that there are other medications out there. But in this case, we're going to be talking about epidural. What is an epidural? An epidural is a regional anesthesia that blocks pain. The main goal of this medication is for pain relief. What causes the pain release is nerve impulses being blocked off from lower spinal segments. So the pain relief only happens in the lower part of the body. Epidural is considered to be a local anesthetic and is often delivered in a combination with other narcotics like fentanyl and sufentanil to decrease the required dose. There's plenty of other combinations that epidural can be administered with, but three of the main ones are fentanyl, epinephrine, and morphine. They can be combined together to prolong the effect and stabilize the mother's blood pressure, which I will later talk about. The blood pressure is a risk that is part of having an epidural administered. The process of an epidural, usually 1 to 2 liters of IV fluids will be inserted into the patient. Depending on the physical of the patient, it'll be either 1 to 2 liters. After that, and there's only certain people who can administer the epidural, and that includes anesthesiologists, an OB, or a nurse anesthetist. A doctor cannot not just any doctor can do this. It has to be someone who's specifically for that. After that, this certain person sees that the woman patient is 4 to 5 centimeters dilated, the cervix is actually open, and you're in true labor, that is when he will have you arch your back, or he will have you lay on your left side. At all times, the patient is required to stay very still, or complications can arise from not putting the epidural correctly. After you're arched, the person will follow to rub your back, clean your back with an antiseptic solution, which is to prevent infection in the area that the epidural is going to be inserted into. After being cleaned with that, an area in the back will be numbed with a local anesthetic with a syringe. A needle is then inserted. After that, a needle is inserted, a catheter is carefully threaded in there into the epidural space. After that, periodic injections, usually 1 to 2 hours after the first dosage, will be putting on. Sometimes if the labor lasts like a very long time, they can't do it anymore. They'll just stop it, and you'll have to go through without any more dosages of epidural. There's 2 different types of epidural. There's the regular epidural and the combined spinal epidural. Both have the same benefits and risks. Some of the benefits for an epidural is that it allows you to rest and remain alert throughout the childbirth, and it might promote a more positive childbirth experience with less molestations. It also helps you deal with fatigue, exhaustion, and irritability. So basically, you'll be able to experience the whole process without being completely knocked out. Some of the risks, though, include blood pressure to drop, which, if that does happen, you'll be required to have more IV fluids inserted in you, medications, and oxygen. Another risk is leakage of spinal fluid, causing headaches. This is said to only happen to about 1% of women, which is very low, but it can happen. The chance is out there. That would be arranged with something that's called a blood patch, and that would be fixing that. It's when they would inject blood through the space where the epidural was inserted, and that would relieve you from the headache. There's shivering, nausea, backache, and difficulty urinating. And also permanent damage can be a risk in the area where the epidural was administered. those are basically like the mom's risks. That the baby also has some risks, which would be the baby might have problems latching on to the mother to breastfeed after the baby's born. It can go through respiratory depression, fetal malpositioning, and in some cases, it can happen that the epidural causes other interventions for delivery, like forceps, a vacuum, or sometimes even a C-section. According to my aunt, I asked her, she's the most recent person to have a baby. She said that if she can go back, she probably would get the epidural again because the amount of pain that she was in was excruciating. So she said she would in a heartbeat, but she did say that she had some long-term side effects. Now, in the area where she did get her epidural administered, she gets backaches a lot, especially during winter. Her lower waist hurts, especially in that area. In conclusion, an epidural is just another drug out there in the medication world that brings relief to many women, just like many other medications. It has its risks and its benefits. But although it has its risks and its benefits, it is proven that 60% of women choose these epidurals.